just that the parents are taking in all this information and data and they don't know what's meaningful. I'd be like, is this important? Is this important? My daughter does this.
Hello, everyone, and welcome back to the ASH podcast, where we look at the intersection of rigorous science, emerging health tech, and the humans who are trying to drive it forward. I'm one of your hosts, Ali.
And I'm Omar, your second host. And today we're diving into a reality that anyone in the rare disease space knows all too well. The existing healthcare system was simply not built for complexity. When a child has a rare genetic disorder, the parents don't just become caregivers, they become the data scientists, the care coordinators, and the ultimate source of truth.
And here's the bottleneck. All of that information almost becomes invaluable or granular data that, while it's tracked at the kitchen table, it rarely makes it into formal clinical research. So our guest today is trying to change that. Kasey Walsh is a parent-driven researcher, mother to a daughter with a rare genetic disorder, and the founder of Winsights. Kasey, welcome to our show.
Hi, thank you. Really happy to be here.
All right. Thank you so much, Kasey, for being with us today. It's a pleasure to have you on the platform. So maybe we can start a bit off with maybe sharing your daughter's story and the specific moment you realized that you had to, get into this area and research area and become the primary data keeper.
Yeah. Feels like so long ago, but also just yesterday when my daughter, who is 12 now, got her diagnosis at 2 years old of an ultra rare disorder called SPG47, also referred to as AP4 hereditary spastic paraplegia. And I can get back to that later. But it looks a lot like cerebral palsy. It's considered a cerebral palsy mimic. So we were actually, quote unquote, lucky that we were able to get this diagnosis because it wasn't on a lot of panels at the time for genetic testing. And immediately, well, not immediately. There was grieving. There was a lot of reconciliation with what our life might look like. She was the 10th person in the world that we had thought, or they thought the 10th person in the world with the diagnosis. 9 others from war-torn and poverty-stricken areas, I was told when I reached out to the person who wrote the publication on the other cases. And, it was very nice. He said, comparing, I was trying to find out for my daughter what the future might look like. And there wasn't much we could gauge from the publications. It was a lot. It was hard because it's slowly degenerative over time and has severe intellectual disability and nonverbal. So he said that it was apples and oranges, that where they lived and what was offered where I live can change the course of the presentation of the disease. And that was one of the first, now thinking about what I'm trying to accomplish with Winsights, it's really knowing that in different places, the knowledge of how to care for a disease is only is capped at the expertise that you're able to talk to. And I'll dive into that later, but we started a nonprofit pretty quickly because I need to jump on social media and find, I know I'm talking all over the place and I know you guys can edit this a little bit, but it's been a while since I've talked about the journey. But I will say that hereditary spastic paraplegia is an umbrella disease group. My daughter's disorder is from one gene out of over 80 or 90 that cause a different type of hereditary spastic paraplegia. Some of them are, I use quotes because it says just lower limb, mobility issues. And it can be adult onset. And then my daughter is globally disabled and she was born with disabilities and then was able to make some gains, in particular walking not well, but and then they gradually lose that over time. It's not fatal though that we know of. So, because I had a history working at the Muscular Dystrophy Association, healthcare service coordinator, and worked with patients and caregivers, I knew that, like muscular dystrophy, HSP being an umbrella term, there might be people on social media that are experiencing some parts of this disorder, even if I couldn't find anyone else to talk to. I knew that spasticity was the, common denominator. So I thought, let's go on and find these groups on Facebook and see if anyone could understand. And that was my first glimpse of how incredibly helpful and supportive these groups can be. Right away, I found another family that actually had a daughter the same age with the SPG 47 diagnosis. And I'm going to keep going on. Did I answer? I know you said to start. I'm sorry.
No,
Um,
it's firstly, I love your passion about talking about it. So I don't think either of us really wanted to stop you because we could see how much your
I've
emotions
told the
are.
story so often that I kind of lose track and I just start getting in the groove and I want to be pointed and be able to get, really the meaning from it. But like you said, to steer directions, when I started this social media group, or when I joined, we found this other family. We started a nonprofit very quickly, got some attention through People magazine, and also a principal investigator at Boston Children's Hospital who, I think he was resident. I can't say what exactly he was at the time, but he was new,
Mm.
and had chosen AP4 or SPG 47 to be sort of his passion project. And he started reaching out and finding other people. And soon we started having people coming to us wanting to know what we were doing for research, what to expect with their child. And all of a sudden I started a support group on Facebook and started hearing from these parents and just through across the world, they didn't have anyone who they thought they could talk to or would understand. And they started finding each other on this group. And it was very meaningful.
I think it's a beautiful story. I think it's an amazing thing to see someone have that moment in their life and use it to not only benefit yourself, but hopefully benefit more in the future. Talking about sort of maybe before you created or went into social media and try to find more people. I don't know if there was a period in time after their diagnosis and before that step where I wanted to ask that what were those crucial variables that maybe you had to track at home or things you had to look at when taking care of your daughter at home that you feel like maybe standard medical charts might have missed, or was just something you hadn't thought about? Or did your background in working with patients of you said muscular dystrophy help with any of this?
And so did you say after the diagnosis and before
Yes.
meeting people or before? Because there was stuff that went on before,
Oh,
might be more meaningful, to be
no,
honest.
that'd be great to hear too.
Um, yeah, because so it's interesting when I worked at the Muscular Dystrophy Association, and I worked in neurology, and the neurologist was great there. He used to tell me what patients had muscular dystrophy so I could go in and talk to the parents and the kids, and or what sometimes he'd say that this wasn't muscular dystrophy, this was Angelman syndrome, and then kind of describe it to me. And sometimes there was this big book in the office and I would read, like go and look in the book. So it's odd. I guess it makes sense that I'm here now because I was always so interested in what was kind of going on with these disorders. I don't know why, but it was just very curious. And this was before children. So when my daughter was 4 months old, she was having trouble taking a bottle, could
Mm.
not figure it out. And I had early intervention come. I went to, nursing groups at the hospital that were support groups, advice to like once she could go on a take solid food, like to maybe stretch out and maybe they thought it was a want of her, a choice. And eventually we found out she was tongue-tied
Mm.
a little bit. And I thought, I wonder if that's, oh, you.
Sorry, just for like anyone who may not know, myself included, can you explain what that means? Like,
Oh, okay. Sorry. Yeah, so there's a little connector from the bottom of your tongue that
Mm-hmm.
connects sort of to your mouth. And to be tongue-tied, it means it's shorter than normal.
okay.
So the tongue
Mm.
isn't able to do as much as it can to manipulate food around. And the pediatrician had said, it might not, it's not that bad. I think it's fine. But when she couldn't take the bottle, I said, it's a simple procedure to get it taken care of. I took her to a specialist and he looked at her and he said, well, it's not just the tongue tie, but her lip also has it's too connected. So between the two
Okay.
of them, she couldn't really get a good grasp on things. And that
Mm.
was like my first real, like, oh, they don't always know, like
Yeah.
it was just like you take the word of the doctor and I'm not saying this in a bad way because how do you know all the stuff, there's
Yeah.
so many things out there, but it was definitely like, oh, okay, all right. Knowing she had all these like global issues, I started really having to pay attention.
Mm-hmm. Yeah, thank you so much for sharing that. It's very interesting to hear how, like, especially from a parent slash caregiver perspective, how you could actually add so much insight and value, not just like for advocating for your child, but also for like what you discover, which can oftentimes like, go under the cover, or like it may be hard for clinicians to really see that. And like you said, like we've talked to like so many like parents throughout the years as we started this, and it's so amazing to hear how much they bring in when it comes to just like real world data for their child, or just real world data for the actual diagnosis. So parents and caregivers, like, shout out to all of them. They add so much value, like, to the community, and like to like just driving science altogether. And that kind of leads me to like the next part of like our conversation, which I really wanted to talk about, which is regarding like the clinician parent trust relationship, which I know that you kind of alluded to earlier. So regarding like the data itself that's out there, we know that it's very clinician driven. And like you said, there's like the bottleneck is usually how far you can get to meeting an expert and things like that. So in your opinion and in your experience, do you think this data gap is primarily a cultural issue, sort of like clinicians not trusting the parent observations? Or is it more so, have you noticed that it's like a limitation in medicine where like they have EMRs and things like that where they just can't handle all this information?
I think it's a little bit of both,
Mm.
because it might not be actually that they don't trust the parents. It's just that the parents are taking in all this information and data and they
Mm.
don't know what's meaningful. I mean, I will tell you the principal investigator from Boston Children's at the beginning, because we were with the nonprofit and funding research, I'd be like, is this important? Is this important? My daughter does this. My son, like, and it's just throwing all of this stuff at them. And at some point they have to be like, I don't know. And I got more refined as I went. I started to understand things more. And I think, I started getting a knack for what was meaningful and not. But it's really hard because their time is so limited. And, he was trying to get grants and propel research, but you have to pick a particular focus on, what you're going to look at, and you got to stick to that. So sometimes it's the ability to divert is not there because of the procedures and what's in place. And then what I learned actually, which is what started making me think about there has to be a better way, is that once there's an IRB protocol in place, which is
Mm.
what is put in protection for human research subjects, to make sure that they are, there's a standard of procedure that needs to be followed and it needs to be planned beforehand. And I remember him saying he cannot send messages out, more than X number of times. And if this something needs to be communicated with the patient community, it couldn't come from him because of, which I'm not saying anything bad about the IRB because it's in place for the protections of both, the patients and the hospital and the clinicians. But I would start going to, so I was like, well, I can ask them. So I'd go to the support group and I'd be like, hey guys, we need this, and hey, we need that. And it was a really good, I think, loophole that I realized. And I was like, well, if I can do this for this, like, why can't I build something that helps us communicate with the patients and caregivers directly for research?
It's amazing. Like, just to see that issue with yourself and see that, like, okay, if I need this problem solved, then maybe there's probably a billion more people in the world who are having a similar issue, because it is so hard to, I think, get face to face with a doctor a lot of the times. And I've seen it in, my, like, the cases of my family members, where if someone's gone for a procedure or just even something minimal, it's like, okay, you have to try to get an appointment. It could just be even for a quick question, but no one else can answer it. And then you don't know whether you should go to the internet, who you should trust, who has experience, who's, for lack of a better word, maybe just like a paranoid crackpot who's on looking at every single medical
And I've been that person.
Yeah.
No, I'm just kidding. I've run the scope of a lot of
Exactly. So to
experiences.
have that sort of in between is, I think, an amazing thing. And that is what you did and what you are currently doing. And which kind of leads me to, well, a lot of what we hear about is, can you maybe, you've talked a bit about it as well already, but just to try to summarize, what is Winsights? What is the goal for Winsights on a basic level?
I think let's try this out, and we can always redo because this is where I stumble up the
Deep breath.
most. But it's a patient powered healthcare ecosystem where patients and caregivers are rewarded for sharing their real world experience by having it turned into actionable insights. So if they are able to share their lived experiences, the more they share, the more voting rights that they get to be able to vote on where, sorry, this is where I'm losing it,
No, you're
to
good.
be able to vote on where funding will go. So it's a venture philanthropy. This insight is valuable. Like when I started, patients own their health data. I wanted it to be that way because I've learned that when I went to a conference for a health, digital health with Mass Bio, actually, and they were saying how important this data is from families and caregivers, and how there's not a lot of variety in the demographics and the people that, so a lot of the AI, I know this isn't simple, I'm going off on a tangent, but long story short is there's a deep need for this kind of lived experience, and any value derived from it, where the patients and caregivers get to steward where their information goes. They choose who gets it. And if there's any income generated from it or financial benefit, it goes back into research, a pot of research. And the more they contribute their lived experiences, the more voting rights that they get to where that research or funding can go to. Ideally, we're starting from scratch.
No.
There's no funding yet. But if it works, I've heard it be considered like a flywheel business model. If we are able to do this right, and if we are able to make it a comfortable and engaging experience that feels safe and can be trusted, then we'll be able to get people on there and talking. And really, it's all about giving back. Not just the funding, but with using eventually AI, machine learning, will be able to track trends, maybe identify diagnoses, which we would not give, but we can refer to different clinicians, differential diagnoses, which, Robbie's, a lot of people with her condition get diagnosed with cerebral palsy and then never revisit. And if we come back with a therapeutic someday, we want to try to find these people. So, long story short, what I'm building is really, as mentioned, a patient empowerment healthcare ecosystem that is designed to give back to their patients and the caregivers, but also towards informing research that is most meaningful to them.
Yeah, I just want to say that that's like amazing. Like I haven't really like come across something like this. It's only been like I guess in the medicine research world where clinicians like on their side they struggle to like get data or really connect with the patient. This is always like their piece of criticism. And like they try their best to make like these registries or like build these databases, but it always cuts short in some way because that patient empowerment principle is kind of not there. It's still driven by them. So it's
Mhm.
amazing to see like a parent and a community come together and really like propel this vision. Like like honestly, all the best to that, and we're definitely going to
Thank
be
you.
following that. Hopefully, our viewers can also follow your journey as well.
Awesome.
And yeah, like it seems like it's going to have like an amazing impact, especially like the point you mentioned about coming back to those same patients in the
Yeah.
future with AI and like the development of therapeutics. We're eventually going to have to give back. But unfortunately, the problem nowadays is that that same community that you're working to help, they may not be there at that time, or it's hard to find them. It's hard to trace your steps back when you don't have something that's patient empowered. Yeah, that's definitely like an amazing goal. I wish the best for
Thank
that.
you.
And really like another question that stems from that, I guess this is for like those individuals and families who want to be involved in this type of platform. There was a term mentioned earlier about like being a parent-driven researcher and finding ways to like implement yourself in that role. Just through your experience, can you like maybe explain to us and the audience like what makes a parent-driven researcher in that sense?
Yeah. It's really, if, on the broadest sense, I would say it is apparent, usually for rare diseases, where when you get the diagnosis, it's a blank slate and there's no dedicated research towards a therapeutic. There might be some research that exists on the biology, and you really just bootstrap it and you talk to whoever's doing what. And then,
Mm,
I started with talking with other parents that I had read about with, gene therapy, doing gene, and you you really just follow the cookie crumbs as much as possible, but you don't give up and you keep curious and you keep motivated and driven to finding something that will help intervene for your child therapeutically.
Yeah, for sure. I,
okay.
I
Thank
was
you so
very
much.
interested when I first saw that phrase in the description we were given. It's like it seems so perfectly used to describe the situation
Yeah.
and as something that probably many people face because I think even when it's the obviously when it's a rare disease, you have to be that sort of researcher as a parent because you would need to be finding out things that majority of the people may not know. But I feel like it happens even when it's something as common as just a cold because uh, obviously I'm not a parent, so I can't describe it as if I was one. But from what I understand, it's like you want to know exactly what is wrong with your child, and so you look into every possible aspect, every minuscule detail of what it could or could not be, and that really does basically make you researchers in healthcare because that's what you're prioritizing. And so it's a perfect thing to describe what is being done with Winsights and what hopefully Winsights will achieve in the future. Because I do think it is an amazing model that is hopefully going to last forever and something that should be implemented more. And
Thank you.
I know we're, I don't know, coming sort of towards the end of our conversation, which I honestly don't want it to end, but
I'm
uh,
here. Just kidding.
maybe we can do a follow up. Honestly, maybe another one to dive in more. That'd be great. But one thing I want to know is you've started this amazing journey. You've started from someone who's had a sort of a background in healthcare with your work, but has seen this dramatic change, and you're trying to influence something on such a grand level and hopefully help so many people around the world, not even maybe in US or Canada or North America, but everywhere. I think people can find this very useful to them. Obviously, like you said, with this comes maybe funding and investors and a bunch of aid from outside as well. It can't just be done by you. You need that assistance to make it that level. So I wanted to ask if you had the attention of maybe every health system leader or a researcher or a policymaker for just even 1 minute at a time, what is that one thing you would want them to understand about the expertise that exists within patients and their families, and maybe why this should be implemented globally?
Yeah. Well, it goes back to that parent-driven researcher because no one is more motivated to put in the
Mm.
effort and put in the work at no cost. And
Yeah.
we're not getting paid. I mean, literally, the payment is feeling like we're doing something and
Mm.
keeping hope alive. It really is being able to when I got Robbie's diagnosis, I said, I wouldn't be able to look myself in the mirror and when she's older if I didn't put every single effort I could possibly think of towards trying to intervene on what might be a very difficult future. And um, that's where we're key. We're paying attention to everything because we have to, because it's for our kids and for us.
All right. That was beautifully said. And I think I couldn't add a single thing to that because that's like exactly like the vision that needs to be propelled for like all those leaders that are listing all the people in power is to like really listen to the parents, listen to the families, and see what they can bring on. Um, yeah. So, Casey, before we let you go, maybe just one final thing, if that's okay. What is
Yeah.
one piece of advice you have for any parent who may be listening right now, who feels, I guess, overwhelmed by the volume of information that they're trying to track for their child when it comes to a condition or something?
Yeah, I think the best thing that took me a long time to learn is that you can step away from it for a
Mm,
minute. You can, and sometimes for me, it's taking my mind away from it, where I start to process and make connections,
mm,
because it's real. There's too much data sometimes, and that's with the clinicians and with us, and it's really hard to understand what's meaningful. So. And trust your gut, I think. Like, if it feels like, oh, this is something, then it probably is because your body and your everything's taking in more than that is needed all the time. And so the things that stand out are probably the ones that are worth paying attention to.
Of course, of course. As they say, a mother's intuition never fails. So if you have that feeling about your child, trust it, try to uncover every stone, leave nothing unturned. All of those things, I think, is wonderful advice. Casey, thank you
Yes.
so much for
Can
letting.
I add in? I feel like the medically responsible person is, find a medical professional.
Yes,
And
of
then,
course,
but also ask questions,
of course.
like second opinions, third
absolutely.
opinions, but don't do anything on your own intuition. I mean, within reason.
No, but I think that's a
Within reason.
great point to add. Yeah, find the right person to give you the answers. If that's a good way to phrase it, and don't stop until you find that.
I
Um,
was literally going to say that. Do not stop until it feels like you've gotten the answer.
Yeah.
there you go. So, thank you so much, Casey, for your words, your vulnerability, and your willingness to open up about what has happened in your life and your daughter's life, and how that has made you stronger in the work that you're doing. And especially, thank you for the work that you're doing with Winsights.
Thank you. Thank you guys so much. This was great. I would look forward to another one if you want to someday. Thank you.
Absolutely. Definitely would like to follow up on the journey. And to our listeners as well, you can find the links to Casey's work and Winsights in our captions. We're going to be posting them everywhere so that way you're able to follow up on the journey as well. And yeah, I guess don't forget to subscribe, and we'll see you next time on the Ash podcast.